Participants kindly join the quiz using the link that is given in the comment section of this YouTube live video. Also, the link for the quiz is shared in Telegram groups also. Kindly join quickly. Quiz will start exactly. Everyone, please join the quiz as soon as possible. We are going to start quiz at 10 p.m. sharp. Link for the quiz is given in Dr. RMD WhatsApp channel, Dr. RMD Telegram page, and JuxtaMed quiz Telegram page. Also, the link will be shared in Dr. RMD official Instagram page.
Yeah, and today from now on, for next 2 days, we'll be having ortho quiz. So in today's quiz, we have basics of orthopedics, fractures, then infections and tumors. So we will have 10 questions today.
Yeah,
Guys, you
already.
can also give us, yeah, you can also give us a feedback after the quiz in the quiz section itself.
I think the participants liked yesterday's first page where we allowed them to write their comments regarding the quiz.
And sir, we have completely successfully completed 3 subjects. I think biochem, pediatrics, and surgery.
Yeah, right. 3 subjects are completed, and those were also very important big subjects. Those who are
Yes.
consistent with this were able to finish these subjects on time. That was the whole point behind JuxtaMed quiz.
Yes, sir. 4 more minutes, guys. We'll start the quiz. Those who are watching us on YouTube live stream, you can also join the quiz by scanning the QR code or directly entering the link provided towards the left-hand side of your screen.
Link is also provided in the YouTube live comment section. You can join directly by clicking on the link. Link is also provided in Dr. RMD WhatsApp channel, Dr. RMD Telegram channel, JuxtaMed Quest Telegram channel, Instagram page Dr. RMD official. So you can get the link through any of these sources. You can join the quiz midway also, but you won't be able to answer the question that have already passed by. You can anyways attempt the future questions. There will be 10 questions in this quiz. The topic for today's quiz is orthopedics part 1. And in this orthopedics part 1, we have focused on basics, fractures, tumors, and infections. So basically, all the named fractures, tumor part, which is very important from PYQ point of view, and osteomyelitis part, which is again a very, very, very important topic. So this is very high yield topic. That's why we have kept this for day one. From tomorrow and day after tomorrow, we'll be having somewhat less important topics. Okay. We won't be having a grand finale for orthopedics, but we'll be having for a grand finale for OBG. And as discussed yesterday during surgery grand finale, OBG grand finale is going to be a cash price based event. So many of the participants had given a positive feedback that they would like to participate. They would wish to participate in a cash price based event. So we are going ahead with OBG being a cash price based event. So we would expect your participation and a thorough preparation for OBG. Okay. So in this next 2 days, we'll be finishing with orthopedics and then we'll be jumping straight into OBG. Also, we'll be trying to arrange an eminent faculty for OBG to conduct this quiz, so it will be helpful for you guys.
And guys, you can attend the daily OBJ quiz, but only the grand finale will be a paid one.
Okay, 1 more minute to go and we'll be starting the quiz soon. So I can see many names of the players who have repeatedly participated, especially Vishnu Priya, Hemant, uh, Karthik, Sriraj, and but I guess many are participating for the first time. What is your opinion, Manoj?
Yes, sir. I can see new players as well.
Yeah,
And I can see players who has followed us from the first quiz also.
yeah, like Hemant, Sriraj.
Yeah.
They were the ones who were there since the beginning.
Yes, sir.
Okay, I guess we are good enough to move for today. So
Yeah.
I think let's start. It's 10, almost going to be 10:30.
Yes, sir.
Okay. So, welcome to JuxtaMed quiz, where we are diving into orthopedics from today. I'm Dr. RMD, and with me is Dr. Manoj. So, let's get started with the first question.
So here's your first question, guys. A 25-year-old male presents with tibial fracture following a road traffic accident. During the healing process, osteoblast activity significantly increased in a specific layer. Which is this? What is the name of the layer called?
So, this layer, it is vital for bone healing. It contains the cells responsible for bone formation, okay, new bone formation, and is typically located below the periosteum. So, think of it as the active layer in the process of healing fractures. So, your time is up. Yes, the answer is cambium layer, and there is a doubt between cortical bone layer and cambium layer between the two options. Right now, Krishna is leading, followed by Mayra, Shanmugapriyan, Komal, and CK.
Okay, moving on to the next question. 45-year-old male presents with chronic osteomyelitis of the tibia. Imaging reveals a necrotic piece of bone surrounded by a granulation tissue and pus. So the devitalized bone fragment is known as.
I guess this is a very important question even during UG. I remember 3 marks question and 5 marks question was specifically asked from osteomyelitis on this specific topic only. So the
Yes, sir.
sequestration and involcrum was the star topic.
Yes, also in the Viva also the sequestrum
Yeah,
and involucrum.
yeah. Yes, right. So almost everyone has answered it right. It's sequestration. Moving on to the leaderboard, Mayra has committed mistake, which has costed her a lot. First is Krishna right now, followed by Shanmuga Priyan, Sriraj, Ashish, and Ko. Moving on to the third question. A 22-year-old military recruit presents with pain in his right lower leg that worsens with activity and improves with rest. X-ray findings are normal. MRI reveals cortical hairline fracture. So, what is the most tricky diagnosis? Again, clues are military recruit who must have walked a lot in his recent days. Pain in right lower leg, normal X-ray, but MRI shows some defect. So,
Yeah, this condition is typically seen in athletes or military recruits due to repetitive stress. And investigation of choice is MRI.
yeah, X-ray will be normal in this case. So, when you go with MRI, you will get some minor changes in that. Yes, it is stress fracture. Leaderboard remains pretty much almost the same, I guess. I don't need to read it out.
Yes. Okay, moving on to the fourth one. A young male sustains an open tibial fracture in road traffic accident. The wound is 8 centimeter in length with extensive soft tissue damage, and the periosteum is intact. There is no major arterial injury. According to the Gustulo-Anderson classification, this injury is classified into which grade?
Yes, Gustello-Anderson classification is one more very important topic where you need to bookmark the pearl and know which grade of classification. So here you'll see that the fracture classification is based on the size of the wound and soft tissue injury. Okay, so this will give you a clue. So this must be a moderate wound size. Okay, and periosteum is still intact, so that gives a clue. The answer is grade 3A, and most of them have answered it right. Okay, Krishna answered it wrong, and Sriraj took the advantage of that. Sriraj is leading right now, followed by Ashish, Shanmugapriyan, Reddy, and Dil. Moving on to the next question. 16-year-old male presents with localized pain in his tibia, persisted for several months. No issue of trauma, pain is relieved by NSAIDs. X-ray reveals surrounding sclerosis. So, what is the most likely diagnosis? A very, very important question from orthopedics point of view. I would say the most important topic in orthopedics is the tumors.
And this is typically seen in young adults and also a benign condition. This lesion has a typical sclerosis around the edges and is often asymptomatic, except for the pain.
Yeah. The answer is osteoid. The pearl that is given on tumors, that is which the name of the tumor along with the common location and what is the clinical feature and the age distribution is the very important pearl according to me for NEET PG exam. So scoreboard is pretty much the same. Let's read it. Sriraj is leading, followed by Ashish, Shanmuga Priyan. 4 plus we have Reddy, 5th Krishna, 6th Indu, 7th X, 8th Kalaivanan, ninth Hemant, and 10th we have Binel Raj.
Okay, moving on to the sixth question. A 45-year-old male presents with persistent pain and mobility at the fracture site 9 months after the initial treatment. X-ray shows a gap at the fracture site and bone minerals are normal. That is, serum minerals are normal. Which part of the bone commonly has this complication?
So this type of complication is more likely to occur in areas where bone regeneration is challenging and the bone is unable to heal properly. So you have to think about areas that have limited blood supply and which are difficult to stabilize. Yes, the answer is diaphysis.
I
So
think
Ashish,
metaphysis has the max blood flow, right, sir?
yeah, I think this was a difficult
Yeah.
question, so that's why there was varied response. Tables
Mm-hmm.
have turned now. Ashish is leading, followed by Sriraj, Shanmugapriyan, uh, Indu, and Kalevanan. And I think Ashish is the only one with the longest streak. Seventh question. Osteoclasts are primarily located in which of the following sites within the bone? Such type of questions are most asked in was asked earlier in previous old NEET papers, but right now such questions have decreased. Okay, but again, this can be from anatomy point of view, also histology.
I think they can give a image and also point out that what is the
Yeah,
location,
correct.
sir.
Yeah, right, right.
Something like that.
So these osteoclasts, they are involved in bone resorption and they are located at sites where the bone is being broken down. So wherever there is active remodeling or near regions of bone injury, they are seen. Okay. So the exact location is in house-shaped Slackland. Ashish is leading, followed by Kalaivanan, SM, Sriraj, Shanmugapriyan, and Tanya.
Okay, moving on to the eighth question. Which of the following radiological feature is characteristic of a giant cell tumor?
So again,
I think easy.
tumor-based question, which is very important, especially the radiological features of osteosarcoma, osteoclastoma. Okay. So this picture characteristic of giant cell tumor. So what is the picture? I think this has to be in the tongue, fingertips of everyone. There is no way
Yes,
you
sir.
can miss this thing. Okay. So the answer is
Yeah, it's
soapophylakidiasis. Almost everyone has given. Onion skin periosteal reaction, I think it's in Ewing sarcoma, right?
yes, sir. Ewing sarcoma,
Sunburst and Codman angle both are for osteosarcoma.
osteosarcoma. Yeah.
Yes, I'm happy that my ortho knowledge is still intact despite being in pediatrics. So
Mhm.
yeah, Ashish is leading. I think the scoreboard is pretty much the same. Moving on to the next question. 14-year-old boy presents with pain and swelling over right thigh for 2 months. He has fever and weight loss. X-ray shows ill-defined permutation with onion skin periosteal tissue. Again, we have discussed just now. Which is the following gene fusion. Okay, so this is a type of question where you feel that you have got the diagnosis and then you see the question is entirely different. So it is the following
Yes,
gene
sir.
fusion is most commonly associated a mixture of ortho and patho question. So yeah, I think this should be easy. It shouldn't be much difficult because the gene name itself is
In
indication
the
of
yes, sir.
diagnosis. Yeah. So,
We got this question this time also.
okay. Yes, everyone has answered it right. So the leaderboard remains the same if everyone answers it right. Ashish is the one leading with the longest streak.
Okay, moving on to the last question. A 16-year-old male presents with progressively increasing pain and swelling around his left knee for 3 months. There is no history of trauma. X-ray of the distal femur reveals a mixed lytic and sclerotic lesion. What is the most likely diagnosis?
Again, tumor-based question, very important question. Again, a radiographic question. I think the image itself is indicative of what we
Self-action
have been
indicates.
discussing. Yeah, we have been discussing this while ago. So if you have been attentive to our commentary, then you would definitely get the answer here. Again, I think here gene mutations can be given, age of presentation can be given, what is X-ray appearance can be given. So this is sunburst appearance, osteosarcoma. Yes. So after 10 questions and end of this orthopedics part one, we have Ashish who has won this quiz. So congrats, Ashish.
Congrats, Ashish.
At second place, we have Kalaivanan and Sriraj.
Yeah, congratulations, Raivanan and Sriraj as well.
Next, we have Shanmuga Priyan, SM, X, Tanya, Indu, Rakshaya, Karti, Sundar, and Binel Raj. So congratulations.
Congrats, guys.
Come back to YouTube Live where we can discuss regarding today's quiz. So today's quiz mainly focused on PYQs. As you can see, many questions are from tumors, fractures, infections, osteomyelitis. Okay, same question will be asked in exam also. When I saw this, I felt like I was giving one more GT in orthopedics. Like I was saying questions from orthopedics in GT. Okay, so the questions have been similar for past few years also. Okay, so come back to YouTube Live. If you have any doubts, you can ask us. So one important announcement is after OBG from 31st, From 30th, we'll be starting with OBG. And one important announcement, OBG grand finale will be a cash prize based event. We'll be releasing all the details very soon. Okay. So those who win the quiz will be getting cash prize. Okay. I think for top 3 positions will be getting cash prize. So prepare well for OBG. Once you finish orthopedics. Okay. If you have any doubts, you can ask in the comment section. Also give us feedback regarding the quiz. I know that you guys, many of you are preparing for entrance exam just because of this quiz. So we plan on keeping this quiz continue till for further few months. Okay. So if you have any doubts, you can ask. Okay. So Sanjay has asked how to remember bone tumors. The easiest thing is there is a pearl or treasure in every app for bone tumors. Just memorize it before giving every GT. And after every GT, memorize it again. Okay. So every GT will be your point. Okay. That checkpoint where you revise tumors. Okay. This are tumor. That is what I also used to do. Whenever I get question on GT regarding tumors, I just used to go back and try to read the whole thing from tumors, irrespective of whether I remember or not. Okay, because the more time you see that pearl, the better is your retention. Okay, so Rajan has told the difficulty level of question that today's quiz was nice. So Manoj is thanking you.
Thank you. Thank you, guys.
Yeah, Vishnu has also told the same thing. Today's quiz, I also felt the same. Like these questions were it was like I attempted a GT in orthopedics.
Thank you, sir. Thank you, guys.
Yes. So I guess tomorrow we'll meet at the same time, okay, at 10 p.m. Part 2, where we'll be having upper limb, spine, and pelvis. Both are very important topics, short topics. So if you have finished those topics, you can then focus on things which you couldn't finish, okay? Like maybe you couldn't finish some topic from biochemistry or maybe pediatrics. So if you finish upper limb, orthopedics, and spine and pelvis quickly, then you can finish this one. You can finish other topics also, okay? You can dedicate that time for something else also, or you can dedicate that time for giving GT also. Yeah. So Vishnu Priya asked, so then on 30 we won't have ortho. No. Ortho, there is no grand finale, okay, because it is a small subject. There's no need for grand finale. But for OBG, we'll be having a grand finale, which will be a cash prize based event. Okay. Okay, fine. So we'll be winding up today's session. We'll be meeting you tomorrow at 10 p.m. sharp. So till then, good night.